This is an explanation of mathematical modeling and COVID-19. Mathematical modeling is a technique of finding a mathematical model to portray some physical event. It's more than just creating a model to match previous data. It has to have an analytical basis, and as we say, with enough parameters, you can fit just about anything. COVID-19 has exponential growth. There is a limit to this growth. There are only so many people in the population, so the disease runs out of people to infect, and people do build up an immunity. Some variables used: I, number of people infected; K is the growth rate per day, an extremely important number; N are the number of people not yet infected; little I is the time step, which is represented by each day. So the change in the number of people who are infected is equal to the growth rate times the number of people who are infected. Each time step is equal to the previous time step plus the change in the number of people, which is K times the number of people infected, which would result in an infinite number of people. So we place a taper on it. So when we run out of people, the last term becomes equal to 0. That turns into 0. This also becomes 0, and we're just left with the number of people who are infected. Does not change. It's equal to what it was before. We ended up with an S-shaped curve. The growth rate is actually the probability of contracting the disease. It consists of two factors: the probability of contacting a carrier, or if you're like the quarantine, how much quarantining is going on. That's represented by the capital letter E. Probability of catching the disease from the other carrier, which could represent personal hygiene, which is represented by the number of P. The growth factor is just equal to E times P, and the growth factor is then the probability of contact times the probability of infection. But K works out to not be a constant. This is because people react to the situation. People start quarantining. People increase their personal hygiene. People start working together. And together, people can reduce the growth rate. This can be measured by watching K change over time. And this change in K is called the education or cooperation factor, which is very important. How important is it? Well, with an education factor of, let us say, 2% for the entire planet, we would have more than 3 billion people who would be actively infected at any time, and the number of deaths would be over 1 billion people. With an education factor of 3%, we reduce the number of active infected cases to 1.6 billion people. However, the world deaths are still over 1 billion people. With an education factor of 4%, the active infected cases would be reduced to 35 million people, with a death rate of over 60 million people. At 5%, we would have over 800,000 deaths, with the number of world deaths being reduced down to 1.2 million people. In the United States of America, the education factor began at about 2%, and America could have been looking at 65 million deaths. With an education factor increased to 0.8, which is what is happening at present, America would be predicted to be having a number of deaths at about 1.4 million people. With an education factor increased nearly to 10%, the number of deaths in the USA would be reduced to 50,000. New Zealand portrays more than anyone, or exemplifies more than any other country, what can happen with a high education factor. New Zealand's education factor at present is a phenomenal 14%. The number of active infected cases has been reduced. In effect, they're over the hump. This was data from yesterday, which is April the 16th, which was April the 16th, 2020, and there were just over 600 active infected cases, and this is predicted to result in about 26 deaths in the entire country, which has a population of about 4 million people. Another factor is called the lag time, which is involved in this model, which is the time from initial symptoms to the time of resolution, and resolution is known as either death or recovery. Death, we're assuming, on average, will take about 14 days from the time of initial symptoms. Recover is also at about 14 days on average from the time of initial symptoms to the time of resolution. The death rate is calculated by the number of dead divided by the number of dead plus number of recovered. It's a different way of people being used to it, but during the middle of the pandemic, having the number of dead over the number of dead plus recovered is very useful, because that number gives approximately the number of people who were infected about 10 days previously. So far, there is only one procedure that has had any effect whatsoever on the spreading of COVID-19, and that happens to be quarantine. We can apply the effects of quarantine and show how culture, social culture, and relationships with governments can impact on the spread of COVID-19.